We have 5 centers on the island of Montreal right now that are almost over 200% in capacity.
Emergency rooms at hospitals across Quebec are over capacity and in crisis mode. Here at the Royal Victoria, occupancy was at the highest in Montreal on Thursday morning at 230%. This despite a crisis cell to fix overcrowding in Quebec launched a year ago by Health Minister Christian Dubé. Health professionals saying with long wait times and staff shortages, everyone is suffering.
We have increased morbidity, increased patients who are living longer, who have illnesses that we need to treat. They're coming to the hospital. And as the years go on, this is going to increase more and more. And we don't have the personnel to deal with it right now.
We often talk about we need to reinvest in the healthcare system, but that doesn't mean paying people more to do their job per se. We just need more staff so that the burden of work on each individual person is a little bit decreased. If you have nurses that have to take care of, to throw out a number, 8 patients, if you can hire more staff and bring that down to 6 patients, if you spoke to most physicians, they would tell you an inordinate amount of their day is taken up with paperwork and other administrative issues. So if you could remove that, that would definitely help a little bit. And this is why the issue is so complicated. There's no one single fix.
With an aging population in Quebec, doctors say the healthcare system also needs more investment in chronic care.
One of the reasons why hospitals are full is because a lot of people are in hospital beds, acute care beds, even though they have chronic problems that don't necessarily require hospitalization. So if you had more long-term care beds, you could move people out of the hospital into long-term care settings. That would then free up hospital beds so people could go from the emergency room up to the medical or surgical wards, which would then free up the emergency rooms and allow doctors there to see more patients. So there is a bit of a domino effect.
City News reached out to the health minister's office, but we did not hear back in time for air.
If this continues to drag on, patient care is going to be affected. What's going to happen is the emergency room is going to get packed with patients, and there's increased chances for medical error and for harm to occur to patients.
In Montreal, Anastasia Dextrene, City News.